Hello everyone, my name is Namra Chaudhary and I am a Master 2 student at Université Paris-Saclay. I'm currently working with Professor Jan Pellu from the Moods Lab, which is a part of CESP team on the topic of cognitive alterations in depression and their link to antidepressant response. According to WHO, major depressive disorder will rank as the first cause of burden of disease worldwide by 2030, and it is currently affecting more than 300 million people. In addition to emotional and physiological alterations, patients with depression also suffer from cognitive alterations, which affects their learning and memory abilities. And so it is important to consider these cognitive alterations in the treatment of depression because they are linked with increased resistance to antidepressant treatment, which has been observed in 30% of the patient, increasing their risk of relapse and reducing remission. But the question that still remains unanswered is what are these cognitive alterations in depression and what are their biological markers? And so, in order to answer these questions, we are working on a translational approach to characterize cognitive performance in animal models of depression and in depressed patients. Using an innovative analysis of probabilistic reinforcement discrimination task, we aim at assessing subjects' decision making, attentional, and motivational processes to decipher cognition. Side by side, we are working on finding new biomarkers of resistance to antidepressant treatment and potentially cognitive alterations in depression. We are analyzing in blood samples from depressed patients the polymorphism of selected genes of interest via TACMAN, a technique that uses polymerase chain reaction or PCR for amplification and detection of selected genetic variants. So in conclusion, understanding these cognitive alterations will help us develop innovative and personalized medicine for depression with cognitive alterations. Stay tuned to know more in the future.